Hello, I'm Barb Taylor and I'm an audiologist with Bentley Hearing Services. I'm going to provide you with some information regarding concussions, the symptoms involved, how they can affect the auditory system, and how you can get help to overcome your symptoms. A concussion or brain injury is typically caused by a direct blow to the head or indirectly from an impact to the body that causes the brain to move within the skull. One type of injury that results in a concussion without a direct blow to the head is referred to as whiplash. Common causes of concussions include motor vehicle accidents, sports injuries, falls, assaults, and blasts or explosions. A concussion can involve unconsciousness, but this is not always the case. As well, not all symptoms occur immediately following the trauma. I have had many individuals report that they were feeling okay after the incident, but experienced the onset of symptoms hours later or the following day. Awareness and understanding of concussions and their ongoing symptoms are increasing all the time. Some common symptoms of concussion include noise sensitivity, difficulties focusing in groups and noise, tinnitus, dizziness, light sensitivity, vision disturbances, memory problems, fatigue, speech difficulties, headaches, and many more. Typically, symptoms of concussion can resolve within weeks of the injury, but some individuals experience ongoing symptoms that can interfere with their ability to return to the activities of daily life, work, or school. This is often referred to as post-concussive syndrome. This can be intensified in those individuals who sustain multiple concussions, particularly if they occur in a short time span. An interdisciplinary approach is essential for the proper management of concussions. This can include physicians, audiologists, speech-language pathologists, physical and occupational therapists, neurooptometrists, rehabilitation therapists, social workers, and psychologists. These allied health professionals work together to help the individual overcome their difficulties and return to the activities of daily life. I have been assessing individuals suffering from concussions and brain injuries since 2013. As an audiologist, I focus on the issues involving the auditory system. Following a concussion, individuals often find it hard to focus when there are multiple talkers, background noise, or in other challenging situations. They can find listening demanding and tiring, and they will have to leave challenging situations to avoid becoming symptomatic. They can have difficulties focusing for long periods of time and often require extended time to process the information. These types of difficulties indicate that the listener's auditory system is having to work harder than the typical listener to be able to hear the acoustic details required to follow conversation. As the situations become more difficult, the individual has to exert more energy to try to understand what is being said. It is this extra energy that causes the individual to become fatigued and exhibit other concussion symptoms such as headaches, dizziness, nausea, and irritability. Our typical assessment includes an extensive case history to identify the injuries sustained as well as ongoing symptoms. This is followed by a hearing assessment to identify a peripheral hearing loss. Sounds are carefully presented to identify loudness tolerance issues. Testing is completed to identify middle ear issues such as fluid behind the eardrum. A speech and noise test assesses the individual's ability to understand conversation in challenging situations. If there is tinnitus involved, we complete an evaluation to determine the impact of the tinnitus on the individual's daily life. An assessment of the individual's auditory processing skills is also completed. Some areas involved in the auditory processing assessment include understanding conversation and multi-talker situations and background noise, selective attention, directed attention, misperception of speech sounds, and auditory memory. Recommendations for treatment or further referrals are determined by the outcome of our assessment and the needs and capabilities of the individual. We make recommendations to provide help in their daily situations, as well as work or school environments. If you suffer a trauma and experience symptoms consistent with a concussion, it is important to seek out proper medical care, followed by support from allied health professionals to ensure you receive the proper diagnosis, assessments, and treatments to aid in your recovery. At Bentley Hearing Services, we are privileged to be a part of your concussion or brain injury management team. Please call me at 226-393-5922 for more information.